This is your instructor, Alice Shapiro, for HIT 154. This is the overview for the digestive system and the urinary system. However, the urinary system will likely be a separate one because I think we're going to run out of time. But for both systems, you are to define the basic terminology and review, describe key characteristics of the diseases that are described here, and we will include liver, gallbladder, pancreas. We will include renal failure, dialysis, kidney stones, and some other diseases. And of course, understand the etiology, signs, symptoms, diagnostic tests, and possible treatments for some of the selected diseases. We'll start with esophagitis. It causes burning chest pains known as heartburn. That's the sort of common term for it. Pain may follow eating, drinking, and hematemesis may occur or vomiting of blood. The most common cause is reflux or backflow of acid contents called GERD, gastroesophageal reflux disease. This is a very serious condition, and the continued irritation of the lining of the GI tract puts an individual at much greater risk for developing cancer of the esophagus. So it's a very, very serious condition. As you can see, it's caused by an incompetent cardiac sphincter, and this allows backflow of acid into the esophagus, acid from the stomach. It irritates the lining of the esophagus, and also it stimulates an inflammatory response. So treatment includes non-irritating diet, antacids, acid-reducing medications, also often sleeping on a kind of a wedge pillow to elevate the individual at night while she or he is sleeping, frequent small meals to avoid the overstimulation and to try to avoid some of the backflow. Alcohol is known at this point to be an irritant and definitely should be avoided in these circumstances. Hemorrhoids are varicose veins lining the rectum near the anus. They can be internal or external and can become very painful. Please review some of the terminologies, like what is a proctoscope, obviously a lighted instrument for viewing the anus. The causes of hemorrhoids are hereditary, but also poor dietary habits, including inadequate fiber, overuse of laxatives, lack of exercise. Kind of our modern, we could say, lifestyle can exacerbate the condition, straining at having a bowel movement. They can develop during pregnancy because of an enlarged uterus, and especially with a very large child, or multiple births, or births that go, or I should say pregnancies that go a bit beyond term. So treatment, adding fiber. This will increase the ability to defecate more easily. Water, stool softeners may be utilized. Peptic ulcers are ulcers in the stomach and small lining of small intestines. These are termed peptic ulcers. Ulcers of the stomach only are referred to as gastric ulcers, and those of the small intestines are referred to as duodenal ulcers. All of them are referred to together as peptic ulcers. So there is a distinction between gastric ulcers and duodenal or duodenal ulcers. They are caused in part by pepsin, which is the protein digestive enzyme which is secreted by the stomach. Also, hydrochloric acid from the stomach can irritate the stomach and the small intestines, exacerbating the problem. And this irritation could become necrotic, leaving dead tissue, leaving a hole. An infection with the bacterium Helicobacter pylori is associated with ulcers, and the bacterium causes mucosal inflammation and can expose the surface, therefore, to the pepsin and the acid. Complications are the pain is caused by the action of hydrochloric acid on the exposed surface of the lesion. Muscular contractions of peristalsis intensify the pain, and the person may experience vomiting, nausea, abdominal pain. Hemorrhage can be severe and can lead to shock. There are many complications: hematemesis, blood in the stool. A serious ulcer can cause perforations, which can lead to peritonitis, which is an inflammation of the peritoneal linings of the abdominal cavity, and this can be extremely dangerous and can lead to death. Treatment: the objectives are to promote healing, and I'm not going to go through all of these treatments because I want you to read about them and review this later on. You can also, as I mentioned, review in the non-narrated the non-narrated PowerPoint that I have for you on this same topic with these same slides. And acids and mucosal barriers will help. If some of the ulcers could be stress or tension related, and so lifestyle changes may help. But we are learning that the bacterial infection and the inflammatory response produced are very common causes. Diverticulitis is the inflammation of the small pouches of the large intestines, and it's an inflammation of these. Symptoms include low cramp-like pain, usually on the left side of the abdomen, because this is where the large intestines will cross the abdominal pelvic cavity. Abscesses can develop. Antibiotic therapy can help, as well as a controlled diet. And when the condition that leads to diverticulitis, diverticulosis, is best treated and actually best avoided with improvements in the diet and lifestyle. More fiber in the diet, more exercise will definitely help the condition of diverticulosis. When diverticulitis itself occurs, then antibiotics are advised, other treatment, and at that time, when there's the actual inflammation, then a high fiber diet is not recommended. Here is what the diverticula look like. So review: there are normal pouches in the large intestine, but if the transit time is slower from low fiber diets or low exercise or not enough fluid such as water in the diet, then actually the waste material can accumulate, and this is also very much of a risk for toxic materials really accumulating in the large intestines. Regional enteritis, or Crohn's disease, as you can see, is an inflammatory disease of the intestine that most frequently affect young adults, especially females. And you can see that there is pain associated with that, and melena, which is a darkened stool due to digestion actually of blood from the GI tract, can also occur. Severe diarrhea can cause electrolyte imbalance. Water and salt is lost in the stool. So loss of appetite, nausea, and vomiting lead to loss of weight. There are periods of exacerbation, remission, and relapse. And in severe cases, hemorrhage and perforation is a threat, so hemorrhage of the GI tract. Dysentery is an acute inflammation of the colon. Major symptom is diarrhea, and it is caused by either protozoans or amoeba. The organisms invade the wall of the colon and cause numerous ulcerations. Antibiotics can be effective. Normally, this is caused by ingestion of water that is contaminated. So various kinds of species of bacteria or protozoa will cause this condition. So antibiotics can be effective for the bacterial forms of dysentery, but amoebicides that kill amoeba are needed for amoebic dysentery, and these are not always well absorbed. Liver disease. Chronic damage to the liver cannot be repaired when liver disease manifests. Jaundice will result because of the buildup of bilirubin, a pigment that is normally secreted in the bile and removed in the feces. So this will not occur. This normal removal will not occur in severe liver disease. The causes of jaundice are the obstruction of the flow of bile, And the lack of bile interferes with fat digestion, so please review the function of bile. Okay, so take a look at some of these causes. Hemolytic jaundice accompanies hemolytic anemias. Red blood cells hemolyze. Excess bilirubin results from the breakdown of the released hemoglobin. Cirrhosis is the chronic destruction of the liver, most commonly caused by alcoholism, but cirrhosis can occur by other destructive diseases that affect the liver. So it says here the exact effect of excessive alcohol is not really known, but the effect of alcohol is, some of the effects are well known, and some of the effects are that when a person ingests alcohol, all other digestive processes in the liver are halted. So digestion of fat is halted, digestion of protein is halted, and fatty tissue in the liver develops, which interferes with the functioning of the liver and ultimately leads to fibrous liver. The cirrhotic liver loses its organization. The liver cannot function. The tissue has none of the liver cell functions. It is replaced, normal tissue is replaced by fibrous tissue. And the circulation through the liver is impaired. Esophageal veins swell, forming esophageal varices. Swelling of the abdominal organs also occurs. Vessels may hemorrhage. Distension of the abdomen, I'm sorry, I got a little tongue twisted. Dissension of the abdomen occurs with ascites, buildup of fluid in the abdomen, and these fluids cannot be normally reabsorbed as they are because of the damage to the liver. There is blockage of the bile ducts, causing jaundice. And here's what a cirrhotic liver looks bumpy, we could say, and the normal liver tissue has been replaced first by fatty tissue and then by fibrous tissue. And on your right is a basically normal looking liver. Gallstones may be present in the gallbladder. The danger of gallstones is the obstruction of the bile ducts, and this will cause inflammation. Or if there's inflammation of the gallbladder because of some other irritation, gallstones can form. Gallstones consist primarily of cholesterol, bilirubin, and calcium when in excess. Certain conditions such as obesity or pregnancy, because of increased cholesterol level, can exacerbate the formation of gallstones, and the incidence is higher in women than in men. Treatment can be sonography and x-ray for, diagnosis. Treatment can be cholelithiasis, which means the breakup of these gallstones, or cholecystectomy, which is removal of the gallbladder itself. And this can also be accomplished by arthroscopic, but laparoscopic surgery, rather than by incision into the abdomen itself. Acute pancreatitis is abdominal pain, and this is the swelling of the pancreas. The protein and lipid digesting enzymes become activated and begin to digest the organ itself in severe pancreatitis. So this can lead to necrosis of the pancreas, very, very serious condition. All right, so please take a look at the diagnosis of this condition. And high levels of pancreatic enzymes in the urine confirm the diagnosis. So let's go back to that slide for just one moment. We don't really know the etiology, but we know that the sort of usual diet in the Western diet, high fat, high cholesterol diets, and also alcohol certainly exacerbate the condition and increase the risk. All right, so I'm going to end here, and I will pick up with urinary diseases in a future presentation, in a future YouTube.